Hi, today I'm going to be talking about implementing a healthcare policy that addresses having safe nursing to patient ratios in healthcare facilities. Right now, there are very unsafe nursing to patient ratios in many healthcare facilities, which means that per each nurse working, there is a very high level of patients on their patient load. What this means is that it is an issue that jeopardizes patient safety through the nurses not having enough time or energy to get to all the patients that are under their care. It causes things such as delaying care for these patients, increasing medication errors, and having nurse burnout in general. It leads to both nurse and patient decreased satisfaction. We see that one of the reasons right now for having these unsafe ratios is due to a multitude of things. One of them is that there is a nursing shortage. Many nurses are leaving the profession. Nearly 20% of nurses within their first year leave the profession altogether, as well as many nurses are going to be retiring within the next 5 to 10 years. It is estimated that about a third of the nursing working force right now will be retiring in that time frame. Additionally, nursing schools continue to be highly competitive. Back in 2023, U.S. nursing schools turned away nearly 66,000 qualified applicants. And so through these things, we see that there are reasons for having these nursing shortages, which make it very hard for healthcare facilities to or feel that they can implement these ratios. And I'd like to address a few of those because we all have the common ground of wanting to have high patient safety and high nurse safety as well. We want people to be safe and to be happy and to be satisfied, and to lower mortality rates. We want lives to be saved. And so one of the reasons that I brought up before that could be an issue for hospitals would be difficulty in these hospitals and healthcare facilities to have the funding to mandate these staff ratios. And we see that actually in the long run, hospitals save money through increasing the quality of patient care and lessening readmission rates. According to AACN, higher patient loads were associated with higher patient readmission rates. Additionally, another study done in Pennsylvania hospitals saw that when they gave nurses even one extra patient on top of their patient load, it increased the likelihood for rates of infection. Another study done showed that higher nursing staff ratios, so having higher nurses to take care of the amount of patient load that they had, they were associated with positive things such as fewer deaths, lower failure to rescue incidents, lower rates of infection, and shorter hospital stays. So we see that this will actually not only increase hospitals' funding that they have right now, but also increasing hospitals' rates for care and increasing their nursing retention. To go on with this, we see that another issue that could be seen is that due to these nursing shortages that I talked about earlier, there wouldn't be enough nurses to meet the ratios that we would need. And the way to address these things is to address retaining the nurses that we already have and that will be coming in. Through managing ratios and implementing policies to address nurse burnout specifically, this can increase the retention of nurses. According to data published in nurses.com from 2022, 29% of nurses across all license types considered leaving in 2021, increasing significantly from previous years. Among nurses who are considering leaving the profession right now, they said that higher pay was the most influential motivation to stay, followed by better support for work-life balance and more reasonable workload. Many nurses also reported feeling that they were not cared for by their leadership, which increased the burnout and retention rates for sure. There is one state that has implemented actually a nurse to patient ratio mandate, and it was in California. This law has actually shown positive results through reducing patient mortality rates, improving nurse retention, and higher quality patient care compared to states without the mandate, which is a great thing. We also know that as we work with getting to the core issue of addressing the nursing shortages, that we can all have the opportunity to have our patients and nurses have the healthiest lives and situations possible. We can all agree that we want to improve the patient outcomes and give our patients the best version of their nurses as possible. And I appreciate this opportunity to talk about this and hope that we can all come together to create this policy.